The Take Care of Maya trial, a case that is very easy to get emotionally involved in because on the surface, it looks horrible. If you watch the documentary on Netflix, you'll certainly know why. You can walk away from that with a very one sided opinion on what is presented there, but there is always two sides to a story. And I think it's important that we take a look at that. And I want to say, going into this, there was things that were wrong on all sides of this case.
Totally.
It is not just
100% agree with you.
here,
Yeah, there's
not
so
just
many
there.
missteps.
Shavaun Scott is with a psychotherapist and author to talk about this case. And Shavaun, this is one that it's a rabbit hole. Over the weekend, I know since we last talked about it, you took a deep dive into this case, watching a lot of testimony and really looking at the behind the scenes workings of all of this. There's a lot that you found, but let's kind of begin with the disorder that they were looking at in the mother, the Munchausen's by proxy or factitious disorder, as it's called, and why they would have gone down that road. Because on the documentary, it makes it look like it was just kind of a split decision. I don't know if that's
Mhm.
quite the case. What did you find as you dug into all of this?
Yeah, factitious disorder imposed on another, which we used to call Munchausen by proxy, is a horrifying thing. And they see it a lot in pediatric settings. So it was not crazy that the doctors went there with at least speculating this could be going on. 90% of the time, it is a mother who is inducing this symptom pattern in the child. And very often, the majority of the time, the mother has some sort of medical background, maybe a nurse, maybe a nursing assistant. And in this case, Beata, Maya's mother, was a nurse, had a medical background. The parent usually presents as completely devoted to the child and very loving. So this is not a situation where you see something that looks like child abuse, but it's considered medically induced child abuse. Usually the parent comes in and is aggressively demanding treatment and often demanding unusual or strange treatments. They've usually doctor shopped. You'll see a long history of bouncing from doctor to doctor to doctor and hospitalizations. And all these things happened in this case.
Mhm.
Um, the CRPS, chronic regional pain syndrome, is very rare, and it's usually associated with an injury to a limb. Someone has had an amputation or a severe break in an arm or a leg. That was not happening here.
Mhm.
So it was a very strange presentation with a very upset. Understandably, she was upset, but she came across as aggressive and confrontational and hostile. And she was demanding huge doses of ketamine that the doctors told her very clearly this could kill her.
Mhm.
We're not sure what's going on. I think another factor here is the doctor that had diagnosed the CRPS was not board certified. He was not an internist or pediatrician. He's an anesthesiologist, and he specializes in CRPS. He did not have hospital affiliations anywhere. And so it is my guess that he was looked at as best a maverick. He sort of wasn't following the mainstream,
Mhm.
which may or may not be a good thing, but I think it raised suspicion. And the doctors were not doing a very good job. Well, they were doing a terrible job of communicating with each other. She had seen over 30 physicians. She'd had other hospitalizations. And at least in one of the other hospitalizations, one of the physicians treating her had said, we need to look at Munchausen by proxy here. So I think the hospital, Johns Hopkins Children's Hospital, I think they were suspicious. I think it made sense that they were suspicious. And if they're suspicious about anything that could be happening in the child abuse realm, they're legally mandated to make a report to child welfare. And so they did. And so I don't think they were wrong there.
Mhm.
But after that, it went completely sideways.
Yes, and that's where a lot of things you just said went completely sideways. Initially, somebody walks into a hospital and makes these sort of demands. they would have been remiss had they not said, "Whoa, wait a second
Yeah,
here. This doesn't look quite right. It doesn't feel right. We have to follow some sort of protocol," which initially it appears that is what they did. But then, yes, everything goes off the rails shortly after that. Obviously, Maya was getting that sort of treatment. She was at that level of it was ketamine, I believe, right? The ketamine
yes,
coma.
yes, yeah,
And so she had built up a tolerance. They were finding that was working for her. But how rare of a treatment is that? Number one, the disorder is fairly rare, but then to have a treatment like this and a mother
yeah,
come in and say, "This is the only way to treat her,"
exactly.
that would be, I guess, similar if there was another case where a mother came in and said that this child needs a crazy amount of opiates or something.
Exactly.
The hospital wouldn't just start handing it out because mom said, please open the dispensary of this.
Yeah. Yeah, it's a rather horrifying treatment because as I understand it, evidence has been presented that there was a 50-50 chance that she would not be normal and
Mhm.
she might die. Uh, as a parent, that would horrify me. This treatment is not even done in the United States, which is why they sent her to Mexico for it. There was a doctor in Mexico who was willing to do this. So, again, that's not something you're going to get in the United States because of the risks associated with it. And I tried to put myself in her mother's shoes throughout watching this. You know, mothers do get very upset when they see their kids struggling. They may want to think out of the box. And in this case, they were also trying hyperbaric treatments and, just a lot of things that were unusual. And I think, again, the ketamine, the going to Mexico, they had spent tremendous amounts of their own money on looking for solutions that would not have been validated by American physicians typically. So it just looked weird, which I can understand.
Without a doubt, it looked weird. But where did things go off the track after that? They obviously were met with these really fantastical claims from mom and from dad. Urgent hysteric as one would be a lot of times when you're a parent. If your child is in pain, you're wanting to get them the help that they need. Did the hospital, were they remiss in anything after the initial diagnosis of their own or view of this on their own? Should they have contacted Maya's previous doctor, albeit them not board certified, and an anesthesiologist? Should they at least have had some sort of communication to get a better
Very
grasp on
much.
what was going on? And why wouldn't they? Why didn't they?
Ethically, we all healthcare professionals, I'm a healthcare professional, we are supposed to consult and collaborate. And this is drummed into our heads, right? Over and over. But in my practice, I've seen there are some doctors who are very willing to be collaborative, and I may call them, they call me back immediately. They're willing to consult. Often we consult frequently. But I have to say, those doctors are in the minority. And I think very often now doctors are under so much time pressure. They're so busy. I want to give them the benefit of the doubt. It's
Mhm.
difficult for them. It's difficult for them to find each other. But I think a really quality standard of care is that doctors consult, they talk with other people who have provided treatment, and they collaborate.
Mhm.
And ideally, we want these cases to be collaborative, not hostile and confrontive. And I think because of perhaps the way the mom came in, basically firing guns, I mean, not literally, but, with her aggressiveness, it put the hospital in a defensive state of mind. And then when we had the doctor that was actually working for children's welfare, DCS, I believe they call it
Mhm.
in Florida, she came in very heavy handed
Yeah.
and very adversarial. And that only amplified what eventually became this legal power struggle. They
Mhm.
hired attorneys, the hospital's risk management, which is the legal department, were really dictating treatment at that point, and it was not a collaborative approach, which is So sad because if everybody, I mean, my fantasy would be get them all in the same room at the same time, everybody pull out their records, everybody pull out what they had seen and go over it in a collaborative way, right? We're here to help the child. It's not a power struggle. That did not happen here, and I think it shows a fragmented healthcare system, which is affecting all of us ultimately.
Without a doubt. One of the things that we focused on a bit was the fact that that individual we're talking about there, who was charged with being the child welfare advocate with DCF, I believe, hired by the hospital itself, uh, Miss Betty. She had a record in the past of she was put into jail overnight a while back and had been charged with uh, kneeling on a child. She has denied those charges. But if you look at the account of what happened at another facility, which she was fired at, and then a $2.5 million settlement was given to that victim, I was fairly shocked that she was working with children at all. I would
Yeah,
think that after a moment like that, you would lose some sort of accreditation or licensing,
yeah,
or you just wouldn't be hired after just a little bit of
right,
vetting.
right.
Should she have even been in that setting to begin with?
No, and even if she did not have these, pre-existing problems, which I agree are
Mhm.
glaring and should have probably resulted in loss of her license, putting her in this position as gatekeeper and basically being dictated to by the risk management department, she was in way over her head with this. And I would think, again, you would have more mental health clinicians involved, you would have a team approach. And again, this was a failure on the hospital's part
Mhm.
to set it up this way.
Sure. I mean, and you do have to look at the reality of thousands of cases do come in a year. Not everyone is going to go completely perfect. It's just when things don't go well and they go way off the tracks, it gets to be very, I mean, quite extreme. Where like we can't go that far off the tracks the way that this one seemed to go. With all that being said, one of the big arguments in this case, and probably the main reason why we're even aware of this case to the level that we are, is because the mother, Maya's mother, committed suicide midway
Mhm.
through all of this, which, obviously people have mental health problems and depression and anxiety. And I can't imagine a more anxiety ridden situation than what she was going through while at the same time being a parent. I don't want to take myself away from being a parent,
Mhm.
and I still would want to be there to help my child get through this. So, regardless of the decision making process there or how it went down through what she was going through, can you really make an argument and say that because of this, and it goes far beyond a mishap here, is responsible for the death of Maya's mother, Beata? Is that has this ever been done before to make an argument like this in court to go anywhere with a medical facility as we're seeing here?
It's not something I've heard of before. The suicide is just an absolute tragedy. And my sense of the mom from watching all the testimony is that she had some vulnerabilities. I'm not saying she had severe mental illness at all, which some people would portray her that way, but I think she had some vulnerabilities. Her sister testified that when she grew up in Poland, that there had been some trauma
Mhm.
history, and a trauma history can leave a person very reactive and tending to be over emotional. And that's my guess, that she was vulnerable here because if she had been thinking rationally
Mhm.
and understanding, she was under stress, but still, father was under stress and he stayed pretty grounded. Mom, I think, became less and less grounded in reality over time as this went on. And to suicide is really one of the greatest forms of child abuse you can commit
True.
because the children will never have a normal life after that. I mean, they are going to carry that form of grief, particularly for Maya. If her mind were to go, which I would guess it was, is that if I had not gotten sick, my mother would still be here. So to suicide under these circumstances. I mean, worst case scenario, if Maya had gone into foster care, awful, awful. But at 18, she would have been back in mom's life. And it's sort of like mom could not see
Mhm.
that by doing this, I am really hurting my children. And that says to me, mom
Mhm.
was not grounded in reality and had some vulnerabilities, I think, going into this. I'm sure she was a wonderful person, as many people have attested to. But it was really this confluence of awful things that just all came together, which makes this case so weird. The other thing is that when mom suicided, she did it in the home, in the garage, but just adjacent to the kitchen. And her little boy very easily could have been the one that walked in and found her body.
Mhm.
And the fact that she was not thinking about that, y you know, I can't imagine as a mom, no matter how upset I am, always putting myself in someone else's shoes and trying to imagine, thinking that by killing myself in the home in this way, that this is a good decision,
Sure.
It's just
It
it's awful.
it really shows, I mean, just how much the blinders can go up when someone
Yeah,
is in that sort of a mental state,
yeah,
and how it took someone to get there that she was, unable to see, further down the road, and that seemed like
right.
the, the only, option for her. Just
Mhm.
an overall, totally tragic case, and of course, we'll continue to follow it here. Thank you for keeping, an eye on this and taking
Yeah.
a deeper dive into it, than we have here in the past. Let's go over to